Okay, it says it's now streaming live on Facebook. So do we start?
Yes, Imran Bhai, you can start in 10 seconds.
Okay.
So the discussants are not yet here. So
yeah, that's what I'm saying. I can only see Shumon. Where is our other discussant?
I just called her. She said she's joining.
Okay. So maybe we can start. She will hopefully join soon. So I think we should start. So welcome everyone to this webinar. So today's webinar is titled Paradox of Korail Slum During COVID-19, Ethnography of Governance from Below. Today's presentation will be done by Dr. Shahaduz Zaman, who is a reader in medical anthropology and global health in Brighton and Sussex Medical School, and he is also a senior visiting research fellow at working with us at BIGD as well across several research projects. Today's panelists, I'd like to also introduce, we have got Dr. Dean M. Shumon Rahman. He's a professor of media studies and journalism, and he's also the director of the Office of Faculty Research at the University of Liberal Arts, Bangladesh. And we will soon be joined by the second panelist, Salma Awal Shafi. She's an architect and urban planner, and a vice president. She's also the vice president of Bangladesh Institute of Planners. Hopefully, she'll be joining soon. Thank you to the panelists for accepting to be today's panelist. Thank you very much. So before we start, let me just say a few things about, we'll obviously get into the details of the research, but I just want to set a bit of a context here. So as you know, BIGD, we had very soon after the COVID crisis hit us, BIGD launched a research program. We called it the Rapid Research Response, which has now become the COVID. We are now part of the COVID Collective, where we are continuing the research around from immediate impact to now looking at recovery issues. And the COVID Collective is a social science research for COVID-19 action. This is being led and driven by IDS Sussex, funded by FCDO. And there are 8 research institutions, of which BIGD is one of them. So we are part of this COVID Collective. And this particular research that we are presenting today is part of the COVID Collective research that we are doing. Now, one of the major studies that we did a number of studies during this time under the Rapid Research Response to COVID-19, but one of our core research has been looking at the livelihood effects of the COVID-19 crisis, and this was done in partnership with PPRC. And I think this forms a very interesting backdrop to the work that we subsequently continued in today's presentation. Now, in that study, we did 2 rounds of survey. We did one in April, another in July, August. So one was immediate after the crisis, very early period of lockdown, and the second we did an early part of the recovery. And there are a few things that we sort of observed there. One was the urban face of this whole crisis, right? We saw that in April, the per capita income decline in the urban area was 75%, whereas in the rural area it was 62%. So the face of the crisis was very much urban. We also saw that the percentage of income earners whose income became were totally inactive was 72% in the urban areas. In the rural areas it was 54%. So there was a clear urban face of this shock, of this crisis, and that was very, very clear. We also saw later that migration, there was this we started seeing in the early phase, there wasn't so much of urban to rural migration, return migration, if you call it. In the second phase of the survey, we saw that about 15% of the urban slum dwellers, that was our survey sample. About 15% of them have actually migrated back into the rural areas, right? And primarily driven by the high cost of the urban centers. And this is primarily rent. And we will see a lot of the rent implication in today's research as well. So primarily because of the rent, there was this migration that was happening. And this wasn't the poorest who were migrating. It was primarily, sort of moderate poor, if you like, pre-COVID moderate poor households in the urban slum areas primarily migrating, and that kind of makes sense. Now, all this forms a very, and then the third area is that we also saw that the face of this whole crisis was also very on women. So I think that the urban and the woman face of the crisis was very, very clear in the surveys that PPRC and BIGD did. And I think that actually forms a very good backdrop to today's study, where what we try to do is, as you would see, we try and take an ethnographic approach to really understand the urban dynamics, slum dynamics from the lived world and lived perspectives of the slum dwellers themselves. Right? So we take a very ethnographic approach to this. And while some of other studies provides a kind of a more quantitative perspective, more kind of seen from, kind of from a lens of above, this is primarily, we're trying to really capture what is really happening in terms of people's lived world and lived realities. And that's where we use ethnographic approach. So this is, we're calling it a puzzle within quotes, and a paradox, and we will explain why that is the case. And we try to really unpack this paradox. And I think what we really come up with is a story of very active agency, but not in the traditional and typical way we basically think about agency. So I think it would be really, kind of interesting to look at this. This has got implications in the way we think about crisis, in the way we think about building coalition and alliances and partnerships. The second area that I think would be really interesting in today's in the research that we did here is the focus on I think there's some methodological innovations here that we have applied in the urban slum context. This particular methodological innovation where we use peer researchers, and of course in a COVID context we had to rely on remote research method along with peer researchers from the slum areas, participants from the who live in the slum itself. That particular kind of methodological innovation, I think, is also in a COVID context, in a slum context, I think is also something quite new in this research. So I think that I just wanted to form that overall context within which we have done this research, and and hopefully we'll get into the conversation in terms of what it really means. And then we have got a great set of panelists today. So we'll sort of start off right now. I will request Dr. Shahaduz Zaman to make his presentation. We have around 40 minutes, Shahaduz Zaman bhai, for the presentation. So we want to allow time. And it's really good that we haven't really crowded this with a lot of discussants. So we'll also give time to discussants to really provide some their feedback and perspectives. And we want to give time to the presenter to really deal with some of the method point and sort of get into some of the details of the research itself. So Shahaduz Zaman bhai, over to you. Thank you very much. Shahaduz Zaman bhai. Shahaduz Zaman bhai, we can't hear you.
Hello.
Yeah, we can hear you now. Okay.
Right. Yeah, I think I was disconnected. So yeah, thank you, Imran. Let me first share this screen. Can you see the screen? Right. Okay. So yeah, first of all, thank you, Imran, for the introduction. And also, I'd like to thank BIGD and COVID Collective for supporting this particular research and inviting me to lead the research. I would also like to thank the research team, the co-researchers Imran Mateen, Farooq Hussain, and Samail Ahmed. The research assistants, Zabir Hussain and Samim Reza Khan. We also had two peer researchers, as Imran was mentioning, a researcher that we have recruited from the community, Jhorna Khatun and Shaun Ahmed. So just to give the background, I mean, it's needless to say that this COVID-19 pandemic is one of the greatest challenges of the humankind. And as we know that although it started in one country in China, but the greatest hit was in Europe, eventually it reached global south. And mostly the cities have been the epicenter for COVID-19 pandemic. And within the city, the slums and informal settlements have been identified as the potential hotspot, with understandable reason. Because of the precarious condition, it was almost impossible to maintain any sort of pandemic prevention measurement, including social distancing and so on. So it had been argued that if the pandemic enters the slum dwellers could be disproportionately affected compared to the general population due to the higher transmissibility of the disease, higher infection rate ratios, and higher case fatalities in the slum. Korail, the largest slum in Dhaka, took on a special significance, also due to its location at the center of the elite residential area of Dhaka. And there have been grim speculations about high infection and mortality in Korail. And we have seen media highlighting the ignorance and indifference of the Korail residents, and how sort of the residents disregarding health and safety directives. They were also portrayed as a threat to the whole city as a potential source and transmitter of the disease. However, although COVID cases and deaths in different clusters of the country was increasing rapidly, surprisingly, very few cases were reported from slum, from Korail in particular, and slum in general. And even a systematic COVID test in Korail in June suggested only 6% of infection rate, which was lower than the other sides of the city. This was done by ICTDRB and IEDCR. So we have seen newspaper headlines, slums of Dhaka where COVID is curiously quiet. That was a headline in Star, Daily Star, or in Dhaka Tribune, talking about Dhaka slum in the dark about COVID-19, and so on. So people were paying attention what's happening there. There were various experts and lay explanations. There were discussion about lack of testing, which resulted this lack of fewer case reports from slum. People also talked about slum dwellers having better immunity because they are exposed to so many diseases and infections already. People also perceive that maybe these poor people have a special blessing from God. So all sorts of explanatory models were going on around the slum dwellers and Korail. So Korail was a paradox, and paradox, I put it in quotation, like inverted comma, quote unquote, because it was paradox mainly from the experts, public health experts, from the urban middle class elites, for journalists, they were trying to understand what's going on there. But we were curious whether, I mean, many people were curious, particularly the academics and the urban middle class. I myself actually received at least a couple of requests from my colleagues and a number of others. Can we do? Can I do a study on COVID? So they all were a bit puzzled. Why? What is happening? Yeah, well, all these middle class, rich, affluent locations are sort of panicked, and they are sort of indifferent to this. So we were also curious what is happening, but our curiosity was not particularly focused on why there is no cases in Korail. So that was more of an epidemiological, even genetic question. We were also not curious. I mean, is there a like politics in reporting in the cases? So those are different research questions. What we were interested is what actually happening in that territory. How people in Korail, the slum dwellers, are constructing this whole pandemic, how they're experiencing it, how do they narrate this experience. So with that, so the main aims of this study was to explore the local narratives of COVID-19, and to understand their lived experience. What did they do during the pandemic? What sense they made out of this this whole pandemic event? And so basically to understand the pandemic from their perspective, the emic perspective of this pandemic. And we were also wondering whether there are homegrown interventions taken by the slum dwellers. We don't know. And if there were any homegrown interventions, what were the mechanisms? What were the governance? How did they organize it? So we, like many outsiders, we were also quite, to some extent, ignorant about what was going on inside that territory. So that was sort of, with those research questions, we started this particular study. And we took an ethnographic approach. I mean, you know, ethnography is basically exploring life in their natural setting. So it's not an extracted data, rather naturally occurring data. We would like to participate and collect data as much as possible within the life world of the people we are researching. So they're a group of people. And basically it analyzes the social world within which people exist and have relationship with others, including organizations, government, and places. Before I present, we used a range of qualitative tools, including in-depth interviews, key informant interviews, participant observation, informal group discussion. We also applied two participatory rapid appraisal, which we call problem solving, problem ranking, and stakeholder mapping. We followed the qualitative sampling rationale, which is a data saturation and maximum variation. And we also used a innovative, I would say, innovative approach to research data collection, which is peer researcher approach, which falls under the participatory research domain as well. The whole idea behind this is that people also can play as a role in a research team as a researcher. Because any lay person also has an analytical capacity. They can draw, collect data, and we can capitalize that particular capacity within the population, within the lay, within the community that we are researching. So the peer researchers contribute in the research process in many ways. They can effectively articulate their experience, link between the researcher and the community, gather data from first-hand experience, and also provide better access to the community. One interesting data source that we have used is we recruited 2 researchers from the Korail slum. We call them peer researcher, one a boy and a girl, those who are college students. We also use their lockdown diaries. They have written diaries during their lockdown period. So that was a very interesting source of data, what exactly was happening there. So as I was saying, before going to the result, I just wanted to say a few words about ethnography as an policy evidence. Just generally, there is a hierarchy in evidence in the policy world, has been a hierarchy. So for many decades, it was only the quantitative evidence that was considered relevant for policy making. But that tradition, that kind of mindset has changed. In recent times, there's a huge interest and acknowledgement about taking ethnographic insight as a policy evidence. And because whatever policy is taken, whatever intervention is taken, whatever program is taken, the sustainability of this program depends on the acceptance, the acceptance of that intervention by the community, by the beneficiaries. And that very much needs a perspective from the beneficiaries, and it must fit with the life world of the community that we are interested in. So ethnography can play a very crucial role in this regard. And ethnography is informed by people's stories, and it can generate insight derived from people's day-to-day experience. And stories as a policy evidence are being acknowledged in I work in UK now, and in their national policies also, stories is considered as a very influential and powerful evidence to formulate policies. So that's also, it's important that we pay attention to the data, what kind of evidence we value. And more particularly for this kind of population, like the Korail slum that we are talking, it is a world in itself. Those who are outside of this territory, it's a complex world, and complex world in itself. It's not easy to get an access to the life world of these people. And the stories, as one of these author I've just quoted, that stories gives the access, narrative stories through their employment can provide access to the world being talked about. So we can have an access to that life world through stories. And it is not the, and the other author that I've quoted, and she's particularly talking from the policy side, that it's not the story that matters for policy making. The value is in what makes the story make sense. So what this story is telling us, so that's important to understand. So what we did through this particular research, that we used all these ethnographic tools, ethnographic methods, basically to collect the story of the pandemic from their perspective, and we pieces these stories together to understand the narrative, what actually happened from their perspective. So all these lockdown diaries, in-depth interviews, key informant interviews, observation of the researchers actually is piece of stories, and that our job was to fit this together and solve the puzzle and understand the narrative. So just, I mean, those who are from, of course, you live in Dhaka, you all know Korail. This is the largest informal settlement or slum in Dhaka. It is the Bureau of Statistics tells us there are about 14,000 households and around 250,000 people, roughly, and it stands on 99 acre of lands. It has a very interesting history, though. This land was sort of in 1960s, actually in 1961, in the during the East Pakistan period. This was a privately owned property, and the government TNT actually brought this land from the private owners with the contract that it will be used only for activities related to TNT. But in early 80s, this TNT actually sold some part of this land to PWD. There were some background issues there, interesting issues of political kind of background. And then the original owner actually set a case that the original contract was not to sell it to any third party. So they said it's the breach of contract. So we did our land back. But then PWD put another case. So this is now there are three stakeholders who claims this land: PWD, TNT, and the private owner. And the it's still under. So there's a case going on, a judicial sort of case. Meanwhile, this land is in a limbo, and within the taking this advantage of this particular unsettled decision, a whole sort of I would say a kingdom has been established with various kinds of political power play, relationship with state, non-state. So it's an kingdom in itself. So and also just to give a sense of the Korail, it's those who have been to Korail, it's quite complex. Sort of it has a complex structure. It's not easy to really have a sense of the territory. So Korail is basically part of two Ward 19 and Ward 20, which is north of Dhaka city. But it's mostly under Ward 20. And there are, within this Ward 20, there are a number of units, but the major two units are Jamai Bajar and Bou Bajar, and there are also other units, Uttar Para, Dokhin Para, Go Down Busti, and so on. There are sort of smaller sections. And within this units, there are 17 blocks. And this is mostly the Ward 20 is kind of the regulating government body which sort of coordinates this. So as I was saying, that what we try to achieve through our ethnography is to come up with a narrative from their perspective. What was happening, what is happening, or what happened, or still happening in terms of COVID, in terms of the pandemic inside Korail. And what we found when we piece together all these stories, we see the COVID, there is a temporality of the narrative of COVID-19 in Korail. So the narrative and the sentiment, and this emotion, or the story changed over time. We are talking about just about maybe 5-6 months, from February or March to August. But within this period, there were changes in the narrative of this pandemic. And we found that roughly there are 5 phases of this narrative. So in the first phase, people talked about the panic and perplexity of this COVID-19, of the pandemic. This was late March. So these time divisions are roughly estimated. And the second phase, when people started to take various individual and household level initiatives to protect themselves from this pandemic. In the third phase, there were more structured community level interventions, which moved from the individual initiatives to community level interventions. In the fourth, and this was from mid-April, and from in the fourth phase, there was a particular defining moment where a number of corona or COVID-19 testing took place in Korail in May and June. And then in the final fifth phase, which is from around late July till now, the narrative has changed from the first phase where they were panicked and perplexed. In the fifth phase, they are sort of a narrative of denial. They feel a sense of safety, and they feel there is no corona, there is no COVID in Korail. So I would just briefly just give highlights of some of the narratives of different phases. But I'll start with the last phase first, because that's when we actually encountered them. Then that's when we did our data collection. So when we went to the area, how did we found them? And at that phase, they were at that time. This was in August, September. At that time, they were in this change narrative of the COVID. So, and we saw there's a sense of denial. So, as this two quotes tells us, one of a male tea seller telling us that we live with numerous problems, and corona is not a concern for us. Hunger is. And corona is the problem of those who live in happiness. We have no time to care about it. So they were not concerned about corona at that time. And in order to get a better sense, as I said, we did a problem ranking. A problem ranking is also a participatory research tool, where the principle or the idea behind is that people defining problems depends on perspective as well as interpretation. How people interpret a certain situation, and how do they define, and what perspective they take about the problem depends on how do they rank the problem, how do they prioritize the problem. So we asked our respondents to just list the 5 most important problems in their life in Korail. And this is just and we try to put it in a graph. And as you can see, interestingly, none of them mention COVID as a problem. Well, of course, COVID was still in the headline, global headline, in the national headline. So the whole world is sort of talking about COVID. Nobody mentioned COVID as their priority problem. As we can see, the main 2 problems were fire hazard and unemployment. Although they linked the unemployment with COVID, they said, yes, this COVID generated unemployment. And one study at Imran was mentioning, done by BIGD and PPRC, told in the early phase of the pandemic, there was almost 50% drop in their income and their employment. So that was a big problem, and it was induced by the pandemic. But generally, they didn't mention pandemic as a problem, but they saw unemployment as the main problem. But there were eviction is always there in the back of their mind. So this they didn't take COVID or corona as a problem. They cited a number of reasons why they don't think it as a problem. One reason was that they didn't have any personal experience. So they as one of the respondents telling us that how can COVID-19 be a problem for me when I have never seen a COVID-19 patient around me? So they haven't seen much patient around, or even if they have seen, they didn't have any severe cases. In fact, we also, as part of the ethnography, we have tried to find out the death incidences within the Korail. So we talked with the imam who does the janaza number of, and also the grave, the people who deals with the graves, and they didn't mention any like exceptional increase in death and during that period. So as they mentioned that they don't see it as they haven't seen the severity of the problem, so they didn't take it seriously.
Dr. Zaman bhai, maybe try and finish within 12 to 15 minutes max.
Right. Okay. Then I have to go very, very fast. Yeah. Okay. So they also have this conflict between life versus livelihood. So they had to choose between livelihood and life. So their livelihood was much more important to them. But this is the narrative when we meet them in August, September. But that's not a static narrative, as have seen in the continuum, the temporality. In the first phase, in the late March, they really had a huge. I mean, they were panicked, extremely panicked, as when the lockdown started. So they knew this is something unprecedented. But when they experienced lockdown, that was quite and a serious experience for them. So as one of the female respondent telling us that at the beginning of the corona, we all were trembling in fear like a baby pigeon, কবুতরের বাচ্চার মতো কাঁপতেছিলাম আমরা. So and everyone in the village. There was no leadership at that time, so there was no government intervention. The NGOs, those who used to work there, stopped working. And the leaders, within the Korail were not seen they were not in the scene, so they were kind of a directionless, and they was trying to do anything to prevent them, protect them. And there were a number of rumors. So this is an interesting rumor. I just wanted, I mean, this time constraint, but I probably just quickly read it. So as I said, the number of respondents actually told us this. I came to know from my aunt who lives in Comilla that the hair and the beard of our Prophet Sallallahu Alaihi Wasallam can be found in the Holy Quran. And if people drink water infused with this hair, COVID-19 will not attack them. Some of us found hair in their Quran and drank the infused water. Neighbors would collect them from houses that found them. We continued doing this for a few days till we realized that it was a rumor, because the Prophet ﷺ died a long ago, and finding his hair beard in the Quran would be impossible. Maybe it was the hair of the person who was reading the Quran. So basically, just to say that they were trying to protect themselves whatever way they could. And they were sort of even following the rumors. So this is a picture during that period. It is a rare scene in Korail. Those who have seen Korail has 24 hours live. It's buzzing day and night. It's almost unprecedented. I mean, they told us that they have never seen Korail in this deserted, like the roads are deserted like this. But after a week or so, in early April, people actually started to also, even parallelly, because there were no outside help, so people started to initiate individual and household level initiatives, various kind of individual initiatives and household level initiatives to protect them. So they started washing their hands. So they have heard it from the social media, from the media. So they try hard to, as much as they can, with the soap, with this hand sanitizer, and they were using face masks. One street hawker told us that he used to sell some different things, but during the pandemic, he started to make face masks, and he did a huge business. during. So people were using face masks. They were also using various kinds of home remedies. The respondent told us this. They have heard from various sources that hot tea, hot water would prevent them. So drinking hot tea and hot water was increased like anything. And there was some interesting, many of you might know there's a herb called Thankuni Pata. It was very popular in the early stage. And people, this was sold quite with a high price to the Korail people. And they were taking this Thankuni Pata with the idea that it would prevent. A particular homeopathic medicine, arsenic album, was very popular with the belief that this will stop or prevent COVID. People were taking number of analgesics. One particular medicine shop was very popular because that shop owner is supposed to have, and we came to know that he was had COVID, but then got cured. So people had the idea because he had cured, he must have some idea about a special medicines that has cured him. So he became very popular and his shop became very popular. People also have taken various spiritual measures, the increased prayer, fasting. And just to say, but there's a number of quite a big number of followers of Dewan Bagi Pir. Some of you may know. The person have just recently died. So this Pir told them to do Murakaba, which is a kind of meditation that can be done individually, collectively. So people have done this Murakaba and individually and collectively during this period. There's another spiritual figure called Dangta Baba, whom they follow, and he also sort of suggests a certain meal. So the point is, did these measures help? That's not the question for us. What we were trying to understand is that people were not just sitting idle; they were trying all the ways, all sort of ways to protect themselves, whatever resource they have, whatever ideas, whatever knowledge they had in their hand, and they were trying to prevent or protect themselves. But in mid-April, there was actually a organized community intervention. So initially, the informal leaders started to communicate between themselves and thought that they should do something. As one of the leader told us that we thought it's enough, we will survive. The slum survives. No one from the outside is going to save us. So we need to fight against our own interests. There was also an interest, of course, a survival interest, but a number of these informal leaders also run different kinds of business and also the renting business. So their main income is renting to different the slum dwellers. So that was also threatened. So the leaders organized themselves and they thought we have to save the people. Also, in other ways, it's saving their own business, their livelihood. So they have started taking initiatives, and the first initiative was to clean the slum. So they didn't have much in their hands, so they used buckets, detergents, Savlon, and other things, and then started cleaning the slum. Just at this point, it would be useful to understand the leadership pattern in Korail. So they had a formal leader and informal leaders. The formal leaders are the ward commissioners, who is a government representative, and the ward commissioner from Ward 20 was the main leader, because that's the main the Korail falls under that ward. And there are also various other informal leaders. So there are committee-based leaders and area-based leaders. So like different Slum Unnayan Committee, Bajar Committee, Masjid Committee. So there were leaders. So they were not formal representative of any state, like state representative, but they were leaders. But they all they have some political connection, like with the ruling party, and the ward commissioner works with these informal leaders. So the community interventions, they have taken various kind of community interventions, as we found that they have restricted mobility. They have all these corridors. alleys of the slum was blocked by bamboo-made gates, sometimes with wooden benches, and this particularly the Watt Commission, when he got involved after some time, he divided the slum into 13 blocks, made a volunteer committee for each block with 5 members. So it was quite a structured activity that they have started. They also have, they continued the cleaning. Now the Watt Commissioner has sort of mobilized some resources from his own fund and bringing a spray machine and other detergent and so on. They also have restricted mobility within the slum, and we have seen, like when, as I was mentioning in the lockdown diaries, how our peer researchers told that they couldn't move within the slum because it was restricted by the volunteers. They also control public gathering. There were a number of tea stalls where they had television, there's chairs, so they have removed the television. They have taken the chair from in front of the stall so that people don't gather there. They might go for tea, but they don't just sit and gossip. There are a number of quotes in that relation. They also made some interesting rule. For example, you put your phone number on the door so that people don't enter into your house. If they want to talk, they will talk from outside the door. They will call the person inside. One of the leader actually put, he had a decorator business, and he put 4 basins in different parts of the slum. There were also support from external sources, but the government support came actually quite late. The Watt Commissioner told us that they were not receiving anything specific from the state. Then he made a Facebook post like explaining the urgency of the need, particularly they were running out of food. And that Facebook post was read by the MP, local MP. And then curiously, he at one point, with his great surprise, he also received a phone call from the Prime Minister. And the Prime Minister actually ensured and asked him to go to the relief, the disaster relief, and they received 200,000 tons of rice. So that was one support. There were also some cash support, but that was not a continuous kind of support. There were other donations of food and cash from various non-state organizations, DSK, BRAC, BSSMU, and relief by many organizations and individuals. And this was sort of managed by the informal committee, the volunteer committee that I just mentioned. They've also, the DSK put 7 hand washing stations, and UNDP put 42 hand washing stations. So there were ample hand washing basins in the slum, which they used. There were posters, banners by different NGOs and also from the government. There was an interesting case. I don't have time to detail on that, but that arsenic album homeopathic medicine, 60,000 bottles of that medicine was distributed by a particular NGO whose one of the patron lives in Germany, who is a homeopathic doctor, and he organized this particular homeopathic medicine to be distributed, and he arranged fund, and so that was quite an interesting case. The police patrolling initially was increased, particularly during the lockdown period. There were more police presence. But at one point, there were the members of the police force were being affected by COVID. So at one point, the patrolling, the frequency of the patrolling actually went down. And there were lots of supplies of face masks, soaps, and so on by different external agencies. So one of our respondents told us that people in the slum have got so much soap that they do not have to buy it for 5-6 months. And if you go and check, you will also find at least 10 to 15 face masks in every household. So this is a picture I took from a Google image when I Googled Korail and COVID. So this is an interesting, it shows that how many masks inside the house. So as we can see, that people have taken various interventions, so medical, non-medical, and relief interventions. So very structured kind of interventions. But at the phase 4, as I was saying, there was in May and June, three COVID-19 testing took place. One was by ICDDRB and IDCR with 600 sample, and they got 6% infection rate. The another testing was done by Bangladesh RB. This was mainly for the pregnant mother. There were about 500 sample. But this result was not made public. We also couldn't find the result. But generally, both the tests, the slum dwellers were not informed about the result, and there were few cases which those were identified as positive. They were notified individually or also kind of secretly. They didn't make it public. And also people had this sense that because particularly RB, after testing, if they would find something or find lots of positive cases, they would definitely do something about it and intervene. So then they had this sense that there was actually there's no alarming result in COVID. And there was another case, this JKG, we probably all know that there was a camp for testing, but then this JKG, there was a huge scandal. They were providing negative COVID result, and the owner of this company was arrested. So they have sort of demolished that camp from the Korail, and from then on they had a different kind of they had this as I was just mentioning that they were struggling between these life and livelihood. They were desperate to go back to their normal life, the general slum dwellers. But on the other hand, the leaders, formal and informal leaders, also they had an interest that they should have. They should resume their business, their renting business, their other business. So their interest actually had a medical, a scientific, as well as a moral ground to believe that there is this test actually gave them this legitimacy and the scientific legitimacy, moral legitimacy, and from then on they had a different narrative. They are no more afraid of this. They're not in a panic, and they had developed this idea that there is no COVID here. We are immune, and there's not COVID is not a problem for Korail, and they have developed different kinds of explanation for this. And at that point, when we did our ethnography, and so just this summarizes the sentiment at that point. I don't know. I mean, this is very difficult to translate, but as you can see, one of the rickshaw puller was telling us that duita bhat khaya pachaye hat muicha kame jai amago corona gonar shomoy nei. So that was the sentiment. So they don't have time for corona at that time. Now, I'll just finish with some concluding thoughts. As I said at the beginning, that Korail is, of course, a paradox. It is an epidemiological paradox, a genetic paradox, and also there are sort of information politics behind it. But that was beyond the scope of this study. We were interested how these people have experienced this pandemic and what narrative they have developed, constructed. And what the ethnography tells us, confirms us that the slum dwellers are anything but ignorant, indifferent, or passive victims, as portrayed by the media or by other agencies. But they are agents. They have registered their situation with a logical thinking, Whether that is right or not, whether that those interventions have resulted, that's a different question. But we were interested to understand their agency, and also it reinforces the power of community governance. We have seen how they have developed this governance from below. So I will just briefly, also it's probably useful to just briefly reflect on the other slum, is Dharavi in India, which is the largest, in Mumbai, the largest slum in Asia. That was curiously also, there was not many cases in Dharavi as speculated. But we have a relatively clear answer for that, because the Mumbai local government has taken robust action to protect and prevent COVID in Dharavi, because they had tracing, testing, isolation mechanisms. So, but that's not the case in Korail. What we have seen that the Korail people, there was some state engagement, but all was basically done by the people within the informal arrangement, within the volunteers, even the external agencies who had interventions or supported the Korail, they have done it through the informal leadership, through the voluntary committee. So it was mostly a community generated initiatives. So the community governance, as I mean, I'm just quoting two authors who talked about community governance and governance from below. So the community governance is a community level management and decision making that is undertaken by, with, or on behalf of a community by a group of community stakeholders. The focus is on community rather than a corporation, organization, local government, or the public sector, is the distinguishing features of community governance vis-a-vis the other forms of governance. And similarly, the other author talking about governance from below is intimately bound up with the nature of competition amongst local economic actors, the openness and competitiveness of local politics, and the coherence and the organizational capacity of civil society. I would like to link this finally with some of the social science thinking, and particularly with the idea of quiet encroachment or non-movement that is proposed by Asif Bayat. What he suggests that, particularly he worked on the urban poor and the urban informal, also informal settlement, like this kind of informal settlements, although they're diverse kind of in terms of background, in terms of provision, but there is a spatial solidarity. They live in a particular space and they have a spatial solidarity. And he talks about non-movement and not like a big political movements, but these urban poors are engaged in what he calls non-movement. Non-movement in the sense these are collective actions of non-collective actors. They embody shared large number of ordinary people whose fragmented but seemingly similar activities trigger larger social change, even though these practices are rarely guided by an ideology or recognized leadership and organization. And what he observes, or he proposes, that this kind of quiet encouragement is tolerated more by the softer state, like in the global south, because the strong state has the resources and ideology to monitor all sector of their life, whether while the soft states in the global south, they actually allow this kind of quiet encouragement, allow this kind of non-movement, uh, particularly in the case of crisis. And we this is an interesting case, as we see in the COVID-19 pandemic. And this very much links with the idea of Ananda Rai, who works on basically worked in urban architecture, urban planning in Indian context. And what she argues that this informality is actually a form of governance. So this is what she writes, that while it has been often assumed that the modern state governs through technologies of visibility, I argue that regimes of urban governance also operates through an unmapping of cities. Forms of deregulation and unmapping, that is informality, allow the state considerable territorialized flexibility to alter land use, and the state itself is a deeply informalized entity. So what she's arguing, that informality is a form of governance in the global south. So I would end here just giving like I would say that this ethnography, which is an emic narrative of COVID-19, encourages us to think two things. One is the relevance of governance from below, and we need to think the whole idea of informality in a different perspective. Informality is generally considered as a kind of a lack, a problem, a transition of a modern state. But whether we can see the potential, see the strength within the informality now, whether informality can be capitalized in a governance sense in a global south, that's something to think about. And also to think about whether ethnography and the stories inside, how we can utilize more ethnographic insights to formulate policies for any intervention, public intervention. So, and there are references here. Those who are interested, maybe I can share.
Yeah, I think
But I'll stop here. Thank you.
Yeah.
Thank you, Imran.
Thank you. Thank you, Shahaduz Zaman bhai. This is really fascinating, both in terms of insights, but also connecting with some larger ideas around governance and ethnographic research. And I think within the broader context of decolonizing knowledge, something that we should definitely have a conversation on today. Fantastic. Thank you so much. We have two panelists, so let's start there. We are about 12 to 15 minutes late. I think we will try and manage the time. So I'll give about 7-10 to try and really stick within 7 to 8 minutes if you can. So I'll start with Shumon. As I said, Shumon Rahman. He is a professor of media studies and journalism at the University of Liberal Arts, Bangladesh. And Shumon has, I'm sure, a lot to say, and he has also been working on very similar methods and similar, kind of ideas in the context of Rohingya slum area as well. Sorry, not slum area, Rohingya camps as well. So I'm sure he can draw on some of his own research as well. Shumon, over to you.
Thank you, Imran bhai. It's a very interesting research by Dr. Shahaduz Zaman on Korail, and well, I did my PhD research on Korail, so I have had a long-term experience, visiting this area. So well, it's not good for us to have a slum like this with us, but it's there, and it actually sometimes it provides us with a unique opportunity to see humankind in this particular setting. So, and well, in normal state, it was a good destination for development researchers to go, but during COVID state, I thank the research team very much, so that they went there, they did this ethnography, particularly with this method novelty, which is called peer researcher method. And I think we would like to know more about this method, peer researcher. How does it work? Well, we know that there are two researchers recruited from the field, okay, and then how does it connect to the researchers who are remotely working with them? So how does this governance works? So this would be something for us to learn more about this process. Well, I think I have a few observations. Particularly, I guess that the research is about informal governance and how does it work in a period of pandemic period and in a slum like this. But the title actually give us a kind of idea that we're talking about something epidemiological, because Korail paradox is clearly indicating something like that, why Korail people are not being infected by COVID, or they have been lesser degree of infection, or this is something that has have been perceived by many other people. So now, as we go through the presentation of Dr. Zaman, we see that this is not the case here. We are not talking about the clinical features of COVID and its infection in Korail. Rather, we're talking about how the governance from within worked during this whole pandemic period. And this is really interesting to know that how does it work, how community manage themselves to fight against this enemy, the enemy which did not actually hit with extreme power in that area, but they had these precautions and time to time interventions with their the measures are basically all conventional measures, soap and detergent and everything. But if you don't have experience of going to Korail, you won't understand the magnitude of the problem, because it's a 250,000 people actually there in only 90 acres of land. So the management is really huge, and they have this unique capacity, and thanks to this informal leadership that that managed to make room for everybody, to make support for everybody. But I think I mean, this is what we did. So we don't know the answer of the paradox yet. So and I think that the goal of the research is not to provide the answer of this epidemiological paradox that we are always curious about. So now the comparison that actually was made by Dr. Zaman was about Korail and Dharavi. So I would like to focus more on that. Is Korail is a feature of informal governance, as we understand from Dr. Zaman's presentation, that it's a kind of community from within. They managed the whole precaution and everything. But in Dharavi, what we know from research on Dharavi during COVID period, that it was a clear-cut state intervention. So yes, both Korail and Dharavi had lesser instances of COVID infections. So now, if we have, I mean, we don't know it statistically how much infection did happen in Korail and how much infection did happen in Dharavi, but we know that there have been lesser infection in both Korail and Dharavi. And one is an instance of informal governance, while the other is an instance of state intervention. And what was the better, I mean, among them that worked? Actually, I mean, community governance is always preferable, but state intervention is always, expected. So now, where the state is not intervening, community governance grows. So, but if the result is the same, then how would we compare between them? This is something that I was actually wondering. So maybe, the researcher will have better answer on that. And another one that actually I would like to flag on is that ethnography is a unique method that the research actually, took as a tool. Maybe, well, this was a very short presentation, and I understand that much of the ethnographic insight has not been shared because, well, the data that we saw in the presentation are mostly likely to be taken from in-depth interviews or some general observations. So maybe when you do you convert it into paper, maybe we will be able to see more of ethnographic insights. So, well, this is it from my side. I think, thank you very much for this
Thank you.
excellent piece of work.
Thank you. Thank you very much, Dr. Rahman. I think you raised a number of very important, points, which I'm particularly, interested in, hearing from Dr. Shahaduz Zaman in terms of the cross-country, the kind of hypothesis that I think Shumon is trying to talk about. If you have got any insights, but I think this would be a very interesting. There's been a kind of a natural experiment in some ways between these two, huge slum in India, in Dharavi, and in sort of Korail, with very different two types of mechanism, but again, very, very different type of statehood as well, and that also needs to be taken into account. So this doesn't exist. These governance arrangements do not exist, in isolation to the overall statecraft and the statehood. So and the making of the state itself. So I think we need to link it up within that overall structure of sort of narrative and sort of state formation and history of state formation. So, but that would be fascinating. Would love to hear on that. Let's move to Salma Awal Shafi. She's an architect and urban planner and vice president of Bangladesh Institute of Planners. So, Salma, over to you.
Thank you, Imran Bhai. I'm no more the vice president. I'm just a council member now, but I would like to represent myself as General Secretary of Center for Urban Studies. And I think you all know that Center for Urban Studies has consistently since 1973 worked with slum dwellers and their social and physical life. And that is the main, what should I say, goal of CUS, to work for the urban poor, to study the urban poor, research on the urban poor. So we have worked extensively on Korail in between 2008 to 10. And in 2010, Center for Urban Studies conducted a slum survey of all districts of Bangladesh and all slums of Dhaka as well. So at that time, the slum population of Korail was like 125,000 people. So it has really close to doubled by that time. And of course, Korail is a unique area compared to other slums because there are people who have lived there 40 years and who have spent their entire lifetime. And when I was working there, my work in between 2008 to 10 was to organize the urban poor of Dhaka, and I found the poor of Dhaka an organization for themselves. It's called ND Bus. Now you see them everywhere. They're registered NGO. By the time I finished my work for Bill Gates, I had registered them and organized them. So, and Korail was the center. We had offices in Korail. They still continue. And Korail slum has received the most benefit among all slums. And they identify themselves, or at that time they used to say, we have three groups: the upper income, the middle income, and the lower income. So you know how the governance there works. There are people who are getting their children educated, who understand, who are very much in league with the power groups. So Korail is different. They have good governance system. And even when there is a fire or any other disaster, they can just, get help, organize themselves. And BRAC being so close to Korail, I think BRAC is always a big support to them, like rebuilding their houses and so forth. For the COVID, I would say that for this study, I think it's a very, very, very interesting study. We really do not go into these aspects of ethnographic study, which is very rare. When people tell their stories and you get the fact out of their narration, I think it's so much more interesting, because when we gather data in a different way by filling up forms, is not the same. So I really appreciate I think how many I said IDI 24 and KII 10, and then there was a lot of informal group discussion, but I think you get the essence of what you want to know, want to study, want to hear from them about the problem. I personally think it would be interesting to know the age group, because I think the age group in Korail is still below 60. And that could be one of the reasons why less COVID or hardly any COVID. And also the way people live in Korail, they have felt so much exposure to the outdoor because their rooms, their abodes are so small, they hardly stay indoors, they're always outside. They have a lot of exposure to the outdoor weather. I think we all know that COVID, for those who have lived in air conditioning and indoor atmosphere, have had more sickness than those. And of course, the hard work, the sweat, it all counts. But I would say, as the study has said, that poor people have also been very, very conscious during the COVID because they want to preserve their life and also they want to continue the work. And I've seen, I mean, they do come to work and they try to listen to those people who employ them. They will take their shower even early in the morning or before going, try to keep their clothes clean. So I think all that has worked very well for those who could not, take medicine or rush to hospitals and get treatment, the poor, I mean. I think the study also brings to light that how pronounced our divide is. I mean, we live close by, side, yet there's so much gap between the rich and the poor, the people of Korail and the people outside. But Korail people, I've found the children, they strive for education. They receive so much of support from GO and NGOs, as we have seen, the amount of help given out to them. So Korail is different. I think it would be very effective if there was another slum, 1 or 2 slums to compare with. That would be very effective. In Korail also, I think the rent is quite under control because of a big community and the governance system there. I think nobody can take more money than is allowed to be paid as rent. I think the study mentioned that it's 99 acres of land. It's almost true. In my study, I surveyed and it was 96 acres and there were 3 landowners. In the end, it's TNT, PWD, and not the private group, or if it's a private group, they've sold it. It was BTCL, who is to own a big chunk. They may have sold to private groups, I'm not sure. So I think I don't want to prolong my discussion, but I think we really have come up with very interesting findings in this ethnographic study. And lastly, finishing about what Shahaduz Zaman.
Sorry, Salmapa, we can't hear you. Okay, maybe she'll come back. Can you all hear me?
We hear
Yes,
you.
yes, I can hear
Right.
you.
I think let us continue. Salmapa comes back. We may give her the floor again a bit.
Getting
Great.
more and more pronounced
Yeah.
in our cities, though we choose to ignore it. We should not ignore it.
Sorry, Salmapa, could you just make your last point, because I think you got cut off a bit. Sheshir dike, we last point take to you arekbar bolen, please.
I said that that informality needs to be studied, that it came out very strongly in this study, that we need to capitalize. It is, I think, should be our goal, our learning from this ethnographic study. And we have not done much. Informality is becoming the most pronounced state of, what should I say, being in this city, in this country, yet we choose to ignore it. We think we have planned our cities, we have planned our lives. We have not. It's just that informality is getting bigger and bigger, and it creates divide, it creates unrest, it creates, what should I say, unhappiness.
Right.
So let's think about and study more, and I request you to carry on in this line more. Thank you.
Thank you very much, Salmapa. I think, first of all, apologies for getting your current designation wrong, but yeah, we will update it and make sure
All right.
we keep it updated. But I think you raised this very, I mean, aside from the informality point, I think Shahaduz Zaman bhai will talk about that a bit. We're actually, I mean, the unique nature of Korail is, of course, there. I mean, we wanted to study Korail primarily because of its uniqueness, because it's sort of geographically, it's also very, interesting and very unique, with the history of a lot of NGO visibility and NGO work there, and, being very close to BRAC, and, I'm very aware of, the sort of the importance of Korail for BRAC's urban thinking. So all that is one of the reasons we wanted to study. But I think the point you raise about that the governance arrangement, even the informal governance arrangement in Korail, are actually quite unique, and they have actually kind of managed to weather a lot of crises together. I think we also are doing a study in less organized slums as well. Shahaduz Zaman bhai will most likely talk about that a bit, if you could. So we are also going to be extending the study a bit to few other slums, and then I think we'll come back to again perhaps later with our findings with respect to looking at kind of other formations as well. So we'll definitely are doing that, and we will do that. Sorry, Salmapa, you wanted to come back. I can see your hand, but you are on mute.
Sorry, I just one more sentence. I think once we can find out a way to how to bring informal life, informal business, informal settlements into a formal process, I think that's when we will really think, we will talk about upliftment of society. I think that's very important.
Oh, absolutely. Yeah, that point. I mean, Shahaduz Zaman bhai, over to you. Maybe 10 minutes, if you could address, I think I mean, of course you'll address what you want to address, but I think what Shumon was talking about in terms of the Dharavi formal versus informal, that whole cross country, if you have some thoughts in that. And I think what Salma talked about in terms of other slum settlements and how we are expanding, and if you have some early findings of variation that you may want to highlight. Thank you.
Right. Yeah, thank you. Thanks to the two panelists for quite some important and useful comments and insights, Dr. Shumon and Salma Appa. Regarding the issue of Dharavi and Korail that Shumon raises, it's quite an interesting point to really explore, and we probably need to think it through. What I think the relationship between Dharavi and the state is quite. We need to put the time in consideration. Dharavi has a history of from the colonial period, so it's more than 100 years of history. And the state is interacting with Dharavi for almost a century. So they have developed a certain kind of relationship, and maybe that it has been formalized more. Well, in Korail, the relationship with state is relatively younger. So that has not even taken a shape, but it's interesting point to explore how this relationship with state and these kind of informal settlements. But that also brings to the point of the formality and informality. Whether I mean that's kind of a puzzle. As I was saying, that I'm also personally interested in the informality of the southern states, and lot of other authors are considering informality as a capacity, even it's not, as I was telling, that informality is not an interface, that okay, all these informal mechanisms will one day will become a formal, but rather what they're trying to conceptualize, whether we can frame it in a completely different way, that informality itself is a form of governance, form of lifestyle, form of living. There are many, as one some post-colonial, decolonial thinkers talk about, that there are many ways of being in this world. So we have a clear understanding of the formal way of living, but we don't have theorized enough the informal way of being in this world. And in the third world countries, in so-called third world or the global south, almost across the world, informality plays a huge role in people's life, in state mechanism, in everyday life. And it's now time that we really go deeper into this whole understanding of this informality. So I'm more curious whether to make all these informal settlements one day a formal setting. Rather, I'm more interested to understand how this informality can be also a form of life, form of governance, and how can we capitalize? I sometimes tell that, I mean, you cannot develop an institute like, I live in UK, and if you want to have a institutes like UK, you need to have 400 years of history of colonization. You have, they have extracted resources, everything for 400 years, and they have established this institution. So it's an impossible utopia to have a city like London. You make a Dhaka someday in London. That should not be aspiration. So it's more of a theoretical, philosophical question. Can we think of an alternative city that would be like us, where formality and informality will coexist? And that's a more knowledge question. So there are a lot to do. So I again, through this BIGD, I got involved in some of the studies, and that also gives me the opportunity to explore some of these deeper conceptual questions. So this Korail study, particularly, Korail is an interesting even case study to not, it's not about slum, but to understand the whole informality in a bigger conceptual, philosophical, and theoretical sense. So we'll probably have opportunity to further work on this. And as Imran said, we have expanded this study to some other forms of informal settlements. Actually, we are comparing, this is kind of a formal slum, but there are certain private owned land slums. The lands are owned by private individuals. And there are also other kinds of slum, for example, even more informal, like the slums in around the rail lines, or it's very unsettled. So there are three kinds of slums. So we are trying to compare this. So right now the data collection is going on, as Salma said, that it would be good to really compare those. And Salma, we also mentioned one thing, that yes, we also need to keep in mind that the slum life is also stratified. It's not just a common one kind of population there. It's stratified in terms of even social class. There are rich, middle class, and poor class within the slum. So that makes it even complex. So there are a lot to really talk about this, and I think we will have opportunity to sort of expand on this. So for now, I'll stop here. If there are other questions, queries from the audience, I also just want to mention that in 15 minutes I have to leave.
Yeah, no, I think I will finish way before that. I don't really see a lot of question. I mean, I think we have discussed this. I mean, there's a question that I can see here from Rubaya Morshed from the Facebook. I think we have discussed this, that it's really about, I think, so the question is, if COVID-19 were to go into the slums, it would still be extremely difficult to contain the virus. So would the researchers then agree that it's more likely that the coronavirus has not entered into the slum community in the first place? If so, why? So, I mean, I think we discussed this. This is not, as Shumon also mentioned, and maybe we need to make it far clearer and sharper in our presentation and the report, that this is not, our purpose is not really to look at the epidemiological puzzle. Maybe we're not looking at this as a kind of paradox in that sense. I mean, we are primarily interested in really using this COVID as a context, as a kind of as a particular point in time, as a particular shock, if you like, to really understand the community, the sort of what is really happening within the slum, and understanding the arrangements. And as Shumon, I think, really pointed out, the measurements that are taken are not particularly unique, but what is really unique and I think really fascinating is the arrangements and the rapidity with which these arrangements have been kind of formed, right? So it's the governance mechanisms, the arrangement, the institutional mechanisms through which the measures were basically, the measures are not particularly innovative or whatever. I mean, what is really innovative are the arrangements and the study of the informality and its interface with the formal structures through which these mechanisms have actually been, put together very quickly and in a very deliberate way, within, with sort of formations within the slum. So I think that is really what this study is really about, and we need to perhaps make that far clearer. Now, if you can connect that with the epidemiological puzzle and work with epidemiologists, who maybe, have things to say around the epidemiological puzzle. That's a whole different, kind of dimension of the study. But I don't think that's what we are really doing, at least for now. I don't know, Shahaduz Zaman bhai, would you like to add anything to that?
No, I think that's fine. I think Mehna said that there's a question from someone, and
Okay.
I actually got interrupted. So I could hear some other musics around, so I would request to mute.
Yeah.
There are
Right
two
now,
raised hands.
I'm
Zareen,
listening
there are
some
two-
musics.
Okay, so there are two raised hands. Let me just check. I think I can see one raised hand now. Abu Saleh Khan, would you like to come and just maybe speak?
Yeah, yes, thank you. Thanks for giving me this opportunity to ask this question. It's not a question actually, like I have an observation then that when Zaman sir was talking about sort of informality, I think that's good, like from this textual perspective, the way we understand the narrative. But then again, like I just want to say that when we say informality, it's if we put it as the opposite form of formality, and then I think it makes another forms of
Sorry,
complexity or
just to interrupt, I
of the
can't
way.
hear because someone's microphone is on and music is going on. So I'm
Now,
completely
Shahaduz Zaman bhai, I think there may be something from your side. I don't think there's anything
no.
music or anything from our side. I mean, I
We
can't hear
don't.
any music.
We can't hear any other background noise.
So perhaps
That's
if you
strange
can just
because
take I think it could be something from your side.
Okay, so should I carry on? Is it okay now?
okay, then yes, maybe I don't know. It's coming
Yeah.
from somewhere else. Sorry, go on.
Yeah, so I'm just trying to be louder so that it makes it clear. So what I was saying that when you say that it's sort of informality, so I think which is fine from this textual perspective, the way we understand the narrative. But then again, like the sort of arrangement you have been talking that within this community there are class and sort of the way they maintain their affairs and all this thing. So I think that makes another form of maybe we cannot read it formality in a sense of which is very structured. That's maybe the limitation of and how to say it's like kind of professional transformation of meaning. Maybe that is the limitation and we should put it there since it makes a very important point to understand this so-called third world governance idea. So that's one of my observation, and I would like to ask you that when you have noticed that sort of precautions they have taken about corona, so there were any sort of like do they really were influenced by media, and because there are so many awareness raising program and advertisement and all that. So did it make any sort of difference in this community? So that's what I just wanted to
Fine.
ask.
Fine. Okay. Shahaduz Zaman bhai?
Okay, just quickly, if I understood you correctly, you were talking.
Shahaduz Zaman, you mute. You're on mute. Yeah.
Okay, so if I understood you correctly, you were saying that even within this informality, within this context of Korail, there are kind of a structure. Yes, I think that's right, but that's not the it's not the structure that we understand from a formal governance kind of literature that tells us. So I think there is scope to really expand on that understanding of this whole even structure of informality. Yeah, thank you for that comment. And regarding the influence, yes, but I mean although that was not our main focus, but we found that people were influenced by the social media. So the kind of hand washing, face mask that they have used actually is an influence of the social the media campaign. They watched television, they watched like online Facebook online and other kind of online sources. So there was a clear influence of the message being circulated regarding safety, health and safety. So I would say, yes, there was influence of the campaign.
Great, thank you all very much. I know Shahaduz Zaman has to leave. We are 7 minutes beyond, so we really need to, I'd like to bring this to a conclusion. Just 2 points that I wanted to raise in terms of next steps. What we are doing, of course, this as Shahaduz Zaman said, we are, also extending this study to other types of slums, settlements, low-income settlements, and slums. So we will get a more complete perspective in terms of, this whole what has been happening here, the emic perspective in terms of the quiet encroachment idea, and how that itself is not uniform and it would be varied, and we would get a rich understanding of that, the variation of that quiet encroachment and its limitations, and how it interacts with, history and more formalized structures. So I think, that historicity and that interface with other forms of formalized structures is going to be really important to really understand this quiet encroachment, how it actually operates in different varied contexts. And we will be doing that work, and we'll hopefully, we'll be able to bring that to all of you soon. So that's sort of one piece. I would also encourage you to connect this work that we have done, of course, with, as I said, the PPRC BIGD 2 rounds of survey, particularly what we are finding with respect to the urban dynamics and urban dimensions of that, because this actually, there are very strong interlinkages there. And we are planning to do a 3rd round of that PPRC BIGD survey hopefully in February, and we'll be able to bring back results to you in March, end of March, beginning April, which would be a 1 year since the first infection would happen in Bangladesh. So I think that would be, we're really looking forward to that. We really like to, we'll invite you, to basically join that. But we're also coming up with another piece of study that has been done, because I think what Shahaduz Zaman Bhai's work, this particular work we have tried to do is try to really explain what is really happening, right? I mean, from below. A very similar type of work, not taking an ethnographic approach as such, but more of a political sociological approach, has been done by Naomi Hussain and Mirza Hassan. And we actually are trying to, and that has been done in a more rural context setting in terms of what actually happened, and trying to understand what actually happened in the COVID response from the community perspective and the community governance perspective. I think what Shahaduz Zaman Bhai's work and Naomi's work needs to be read together. I think they really form a very, kind of a very rich, kind of a narrative and perspective in this whole informality and governance from below. So I would really encourage, and it's all available on our website. And we are trying to bring all of this together in the next state of governance, which we are hoping to publish sometime in June this year, which is going to be on looking at this informality and governance from below, and and I think that COVID, we're not trying to explain whether it's been successful in managing COVID or not. We're not interested in the epidemiological side of it. We're really interested in what it allows us to look in terms of the possibilities of informality as capability, and rethink governance within our own contextual framework. And I think that is what we're really interested in. So we're going to have a state of governance that will basically come out soon on that. Finally, I think a colleague from School of Public Health, Bashir Akhtar, we have been really chatting. I think we are already seeing across the number of studies we have done around COVID-19, not only BIGD, across different institutions in Bangladesh, we've been extremely active. And I think, and we've been very innovative, and there have been a lot of innovative methods that have actually been employed. I think it would be really great to take a step back and look at all this methods innovation, and maybe have a separate, kind of stream of work that tries to really bring together this methods innovation that has been happening in quantitative surveys, in ethnographic work, in qualitative case studies, using phone-based mechanisms and peer researchers and so on and so forth. So I think there's a whole methods work that I think we should really contribute, to the world in terms of, I think Bangladesh can actually show great leadership here as well. So I look forward to, working in that space as well, communicating and connecting with some of you later. So with that, I would like to conclude and thank you very much. And thank you, Shahaduz Zaman Bhai, Shumon and Salmapa for your time and all of you. And let's keep connected. Thank you very much.
Thank you.
Thank you.
Thank you for that.